Good afternoon. My name is Rebecca. I have chosen workplace bullying and harassment as my topic. What is bullying? Bullying is any act that can make a person feel scared, intimidated, upset, and worthless. Bullying can happen in many forms: verbal, non-verbal, physical, sexual, racial, discriminative, relational, belittling one, spreading rumours, and exclusion are all forms of bullying. Bullying can happen face to face, direct or indirect, over social media, or in a group targeting one. Lastly, bullying can happen anywhere, anytime, and to anyone. I've just put a picture up here of some statistics in Australia. Mental disorder claims that involve harassment or bullying: 1 in 3 women and 1 in 5 men. Almost 20% of workers say they have experienced discomfort due to sexual humour. 22% of workers report being physically assaulted or threatened by patients or clients. 39% mental disorder claims caused by harassment, bullying. Why is bullying a health and safety issue? The impact that bullying can have on someone is severe. The victim or the witness can often feel distress, anxious, have panic attacks or disrupted sleep, physical illness harming oneself or others, loss of confidence and self-esteem, feeling depressed and isolated. The impact that bullying can have on the workplace: high staff turnover, low morale and motivation, increased absences, loss of productivity, costs associated with counselling and support, costly workers' compensation claims or legal action, damage to the reputation. Top things to know: just like other kinds of bullying, sexual bullying is intended to hurt, offend, or intimidate another person. Sexual harassment is not your fault. Nothing you do makes you deserve it. If someone does or says something to you that you think is sexual bullying or harassment, or you see something happening to another person, talk to. Why is bullying a problem? There have been increasing rates and frequency of persistent workplace bullying. Has been shown to have detrimental effects on workplace satisfaction, workforce retention, and the psychological and physical health of nurses, as well as implied effect of quality of patient care and safety, and a mild risk to health outcomes. Just got another picture of a few words that are associated with bullying and harassment: threat, violence, behaviour, emotional, cyber, abuse, prevent, scared, intimidation, domination, office, depression, home. What is currently being done about bullying? Bullying is a health and safety hazard. Stand up, speak out, bullying stops here. Why is it important to patient safety and a healthy workplace? Bullying can impact the health and safety of a nurse, patient, and or workplace. When someone gets bullied, they may get upset and 93% of respondents to a recent IHR Australia poll suggest that managers in Australian workplaces are not adequately equipped to address inappropriate behaviour. How, how can effective leadership mitigate or resolve this problem? Some managers may prevent or engage in bullying in the conflict in the workplace. There is 4 types of management: constructive, incomplete, disengaged, destructive. Constructive management can be viewed as the best practice approach. This is because the response to bullying from this group is large. How can effective leadership mitigate or resolve bullying? Organisational leaders review current policies and procedures, provide easy to access information, hotline and support systems, process complaints fairly, implement training. Managers keep your ear to the ground, address concerns and all forms of aggression, walk the talk, arrange and support intended training, give respect, earn respect. Employees, know it starts with you, model and support ethical, respectful behaviour, communicate. If you see something, say something, attend and participate in training. Remember, as a team, we are all responsible for creating a healthy workplace and patient safety. Picture at the bottom just states where do you draw the line: harmless banter, awkward laughter, quite harsh, out of order, upsetting, offensive, and potentially dangerous. Bullying and harassment in the workplace. What workplaces can do. Encourage everyone at the workplace to act towards others in a respectful and professional manner. Develop a workplace policy and program that includes a reporting system. Educate everyone about what is considered bullying and harassment and whom they can go to for help. Treat all reports seriously and investigate them properly. What is nursing clinical leadership? Leadership styles contribute to team cohesion, lower stress, and higher empowerment and self efficacy. Authentic leaders offer good role models consistent with values and a good vision for healthcare. They also offer individual consideration for staff, provide motivation. What is nursing clinical leadership? Leadership is a skill for nurses at all levels, junior, new graduate, right through to senior nurse. Good leaders are expected to have good problem solving skills and a vision for the future and equipped with strategies and a plan for the future. Developing trusting relationships with peers and co workers as an effective leader. Learn how to talk and to listen to your co workers. Like any relationship, it takes time, effort, trust, and communication for any good relationship. What can co workers do to stop workplace bullying and harassment? Listen to the target, don't gossip, offer support, employee assistance program or counsellor, document details of what you see to share in an investigation, dates, details, witnesses, tell the bully to stop. How do I explain clinical leadership to a new graduate nurse? Arrange an education seminar and professional development program to help struggling new graduate nurses. Developing clinical leadership skills is critically important. Ask them to seek help if they feel they are being bullied or harassed. Introduce safety to the patient and nurse and a healthy workplace. Quality issues, workforce shortages, rates of change, and complexity. If you don't help, how does the research support the presentation? My research supports my presentation because of the facts and the sources I used were published in the last 10 years. To ensure nurses and patients have an understanding of bullying and harassment, what it is, and what can be done to rectify the situation if one arose. To give information to patients, family, and nurses about seeking help online or over the phone to ensure we have a healthy workplace and we feel safe at work. Communicating information via a video. When most people think of digital communication, they think of blogs, posts, or tweets. But the truth is that online videos are becoming rapidly popular for internet users. In fact, figures have shown numbers grow from 68% to 83% since 2012. The use of different types of devices. No one likes you, you are ugly, you're fat, you're a loser. Just some of my references. Thank you.